we're doing everything perfectly, we can only get to 25 to 30% of what that animal can actually do on its own. So it's very important to make sure that we're being effective during chest compressions. So the guidelines are 100 chest compressions per minute. So basically that means go fast. They should be effective, but they should be fast. I don't count how many chest compressions I'm doing because I'm thinking of everything else. I'm just remembering go faster than is probably what I would think I should do. We want to make sure that we're spending the same amount of time in compression as we spend in relaxation. So it should be a very rhythmic movement, so it's a 1-to-1 ratio. Now, the chest cavity in a normal animal has negative pressure between the lungs and the chest wall. So there's a negative pressure here. So when the chest wall recoils or expands, it's pulling the lungs with it, which is pulling air down into the lungs and also pulling blood back into the heart. Okay, so we want to make sure that the chest wall completely recoils to have that sucking effect to bring everything back up into the chest cavity. So I think of it a little bit, an analogy that I have is a sponge sitting in a tub of water. It's completely absorbed as much water as it can. You push it down halfway, you let out some water, and then you only let up a little bit. It only has the ability to suck up a little bit before you push it down again. But if you allow that sponge to completely recoil, you're sucking up a lot more water before you push it down again. So it's the same concept in the chest, essentially, is you need to bring blood in before you push it out. Now, it's kind of an additive effect. As you're doing chest compressions, it's building and building and building, and you're getting better circulation, better blood flow, better cardiac output. The second you stop, it's kind of a downhill slope. You lose all of that ground that you gained. So we want to minimize the number and the duration of interruptions of chest compressions. So basic life support is considered 2 minutes of chest compressions without stopping. To get to that 25 to 30%, you have to do everything effectively for 2 minutes, okay? After 2 minutes, we typically switch people that are compressing because they found statistically that you're not doing as well as you thought you were, even no matter how strong you are. So it's a very coordinated movement. So if I'm sitting here doing chest compressions for 2 minutes and someone's breathing, someone's doing drugs, we talk about it. We say, okay, it's been 2 minutes. It's time to change compressors. So everybody talks, and I say, okay, all, get drugs. This person's going to breathe, and we coordinate our movement. Someone's ready with the stethoscope to listen, and if we hear nothing, we go right back to chest compressions. It should be very rapid. So again, we want to make sure that we're following all of these criteria. Now, when we talk